On March 4, 1918,
the first documented
cases of a virus that would become
one of the deadliest
pandemics in human history appeared. What began as isolated incidents of severe respiratory illness in small communities in the United States quickly
spread across cities, ports,
and military camps. Soldiers, already weakened by the harsh conditions and malnutrition of World War I, became the unwitting carriers of the disease, moving it across borders and oceans as troops were deployed and transferred.
Within weeks, hospitals became overwhelmed, crowded with patients suffering from relentless fevers,
coughing, and severe fatigue.
Nurses and doctors worked tirelessly,
often without sufficient protective equipment or knowledge of how the virus spread, and many medical professionals themselves fell ill as they tried to care for the sick.
Families were devastated as children, parents,
and the elderly succumbed to a disease that seemed to strike indiscriminately, leaving entire households grieving in silence.
Cities attempted to respond, enforcing quarantines,
closing schools, theaters, and churches, and restricting public gatherings. Yet, the virus spread faster than authorities could manage,
traveling along railways,
through shipping ports, and from urban centers to rural villages.
News of the outbreak spread unevenly, and in many countries, wartime censorship meant that the true scale of the crisis was obscured.
By mid-1918, hospitals were filled beyond capacity, morgues were overwhelmed, and temporary medical stations were
hastily erected to manage the growing
numbers of the sick and dying.
Communities grappled not only
with the physical effects of the flu, but also with
the fear and uncertainty it brought. People abandoned streets, and cities became ghost towns.
Yet the virus continued its relentless advance. Indifferent to class, age, or nationality, scientists and doctors struggled to understand the virus,
experimenting with rudimentary treatments and preventive measures, but most were powerless to stop its rapid spread.
By the end of 1918, it is estimated that more than 25
million people worldwide
had died from the Spanish flu,
surpassing even the global death toll of
World War I. The pandemic left a
permanent mark on public health systems,
shaping future responses to infectious disease outbreaks, and influencing scientific research in virology and epidemiology for decades to come.
Reflecting on March 4, 1918,
we are reminded of the fragility of human life in the face of invisible threats,
the importance of preparedness, and the resilience of societies confronting catastrophic events. Even in the darkest moments,
communities found ways to cope, to mourn, and eventually to rebuild.
History teaches that the lessons
learned from past pandemics about collective responsibility, scientific research,
and compassion remain vital for the generations that follow. The story of the Spanish flu is not just one of death and despair,
but also of human endurance,
ingenuity, and the ongoing
quest to understand and overcome the forces of nature that challenge us all. History is not old. History is living inside us.
One day, one event,
one lesson.
Mr. Fidi,